Today we have discussed in detail about two things. First of all, smoking and alcohol. These two things, nowadays are spreading very rapidly, especially in the youth. So beware. First of all, we have talked about tobacco, in which we have talked about cigarette smoking. Then we have discussed about alcohol, chronic and acute. So let's start from the very beginning. Tobacco. There are, it's a common name for several plants. Tobacco. There are more than 70 species of tobacco plants are present in the earth. But most importantly, commercially, you can say the number one crop is Nicotine tabacum, and tobacco is the most common cause of exogenous cancer. In that exogenous cancers, 90% are lung cancer. So again, tobacco is the most common exogenous cause of cancer. In that cancer, out of 100, 90% is lung cancer. And if you talk about oral cancer, there are two types. You can say the etiologies, the causes, the ways how oral cancer happens. First of all is cigarette smoking, and second is smokeless tobacco. In smokeless tobacco, we have snuff. We say in our wording, swat. And second one is chewing tobacco. These are the smokeless tobacco plus smoking cigarette. These two causes can lead to the oral cancer or cancer of the oral cavity. You can see their pictures are present on your cigarette tags also. Then we have lung cancer. There are two other causes. First of all is active smokers who actively smoking the cigarette, and second one is second-hand smokers or passive smokers, or the person who is exposed to tobacco present over in the environment. Okay, then we have talked about some statistics about cigarette smoking. Out of 100%, 2/3 of smoking happens in 10 countries. Out of 10 countries, we have discussed about 5 countries. Number one position carried by China. There are 30% of out of these 2/3, 30% of smoking is done by Chinese, and Chinese having the largest China is the largest producer and consumer of tobacco. Then second one is in India, where we have 10% out of that 2/3. Third one is Indonesia, then Russia, and finally fifth number is United States of America. In United States, there are 400,000 deaths due to tobacco per year. Then we have discussed about some smoke, which comes from that cigarette. It is having 2,000 to 4,000 substances, and out of these 2,000 to 4,000 substances, we have more than 60 substances that are carcinogens, which are causing the cancer, carcinogenesis. And out of these 60 carcinogens, more than 60 species, more than 60 substances are carcinogens, which causes the cancer, which we have tar plus polycyclic aromatic hydrocarbon, benzopyrene and nitrosamines are carcinogens, which are simply causing the cancer. Then we have talked about phenol. The mechanism of action is mucosal irritation and tumor promotion. Mucosal irritation, simply when the phenol is the agent in the smoke, it will irritate the mucosal lining of the tracheobronchial tree. It will end up with inflammation of the mucosa and increase production of the mucosa, and as a protective reflex, cough. In order to clear that tracheobronchial tree, that cough will, after smoking, people do cough. Why? Because smoking agents will irritate this mucosa of the tracheobronchial tree, that will end up in the increased production of the mucus, and to clear that airway, there is a cough. Then we have talked about carbon monoxide. Carbon monoxide, it impairs the oxygen transport and oxygen utilization. Then formaldehyde is also an agent in the smoke. Formaldehyde plus nitrogen oxide, they are also leading to this mucosal irritation plus toxicity to the cilia. Cilia, you can see the finger-like projections, which helps in mucosal clearance. And then lastly, we have nicotine. This is the most notorious substance in the cigarette smoke due to having a characteristic called addiction. Due to this factor, if we remove this substance from the smoke, then it is absolutely easy for everyone to quit smoking. But due to the presence of nicotine in the smoke agent, it is you can say very difficult for the smokers to quit smoking. And what nicotine do? It stimulates the ganglion. It leads to depression and tumor promotion. It is addiction. That is why the smokers is very difficult to quit smoking. And nicotine will stimulate the nicotinic acetylcholine receptor in the brain, that will ends up with the sympathetic neurons will increase the secretion of catecholamines, epinephrine or epinephrine. That will end up with increased heart rate, increased blood pressure, increased cardiac output, and increased cardiac contractility. Then other statistics like 70%, 75% of the non-smokers will lead a life till 70 years of age. 70 years they can live, but 50% of the smoker can go to the 70 years. And if we talk about the risk, it depends upon the number of cigarettes or number of packs of cigarettes per day multiplied by number of years. Okay, that was about a few things about tobacco. Now we will talk about smoking related with lung cancer. There are 4 mechanisms, or simply 4 things we will discuss. Number 1 is smoke agents will irritate the mucosal lining, mucosal surfaces of the tracheobronchial tree. That will end up with inflammation and increased mucus production. And due to increased mucus production or inflammation, this is called bronchitis, or simply you can say acute bronchitis. Then smoking agent can lead to the recruitment of the leukocytes. Due to recruitment or increased entry of leukocyte into the lung tissue, that will increase the elastase activity, and due to this activity there is a damage to the lung tissue that will ends up into a disease called emphysema. Then smoking agents can also cause chronic bronchitis and can also cause chronic obstructive pulmonary disease. Then we will talk about smoking associated with other disorders, especially the other cancers. Smoking can cause cancer of the esophagus, can cause the cancer of the stomach called peptic ulcer. Basically, the peptic ulcer is not only cancer of stomach, but it is also cancer of duodenum. Cancer of stomach plus duodenum, you can see it is called peptic ulcer. Then cancer of the pancreas, kidneys, cervix, urinary bladder, bone marrow, and cancer of blood cells called leukemias. Then smoking is associated with myocardial infarction because smoking agents will causes atherosclerosis. How? Because they will increase the platelet aggregation, and they can also increase the myocardial oxygen demand. They decrease the threshold for ventricular fibrillation and decrease the oxygen supply. So once again, due to the aggregation of the platelets, what will happen? The blood flow to the heart will be occluded, obstructed. So due to this occluded blood vessel, there is less oxygen to the heart. So that is why there is increased oxygen demand to the heart, yes, and decreased oxygen supply to the heart. Demand has been increased.
And product delivery is decreased.
Yes. So again, there are 4 things we should not forget about atherosclerosis. Because what is atherosclerosis? Fibrofatty plaque or atheroma present in the blood vessel that occludes the blood vessel, leads up to the necrosis. Due to the obstruction of the blood vessel, there is no oxygen supply to the tissues, ends up in necrosis and myocardial infarction, and heart attack will come into being. So these smoking will aggregate the platelets together. Due to aggregation, there is increased oxygen demand to tissue and decreased oxygen supply to the tissue. Increase oxygen demand or increase oxygen demand and decrease oxygen supply is also happens due to 2 factors. One of factor is carbon monoxide agent present in the smoke, which impairs the oxygen utilization and transport, and lungs, because we have discussed emphysema, COPD, bronchitis. All these disturb the normal lung functioning. Due to the abnormal lung function, it is impossible for the lungs to carry the pure oxygen normal quantity to the heart. Okay, then we increase threshold to the ventricular fibrillation. When due to ventricular fibrillation, the heart is unable to pump blood to any organ of the body. It's just pumping randomly more than 200 to 300 beats per minute, but it is not pushing blood to any organs forwardly. And it also causes hypertension and hypercholesterolemia. Then smoking associated with pregnant female, if a pregnant female, specifically in first trimester, it will end up with a spontaneous abortion, or you can say miscarriage before 20th week of gestation. It leads to preterm birth, you can say the delivery of the baby before 37 weeks of gestation. stillbirth, the baby will come into being with a dead, you can say dead baby. Then it also intrauterine growth retardation. The baby will suffer if the mother is having smoking especially in the first trimester. Then there are some environmental factors, like if there is environmental smoke is equal to active smoking. Okay, if there is a non-smoker who is exposed to the environmental smoke or tobacco, it is having 1.3 times more risk of cancer than that non-smoker who is not having environmental tobacco or who is not exposed to the tobacco. So 1.3 times more cancer risk in non-smoker who is exposed than the non-smoker who is not exposed. Then these non-smokers are passive smokers basically. Second-hand smokers are passive smokers who are actually not smoking, but they are inhaling the tobacco which is present in the environment due to some active smoker or some any other factor. Increased level of cotinine, that is a metabolite of nicotine in the passive smoker's blood, can be seen. And then in children, what are the consequences if they are the second-hand smokers or passive smokers? It will end up with the respiratory illness and asthma in the kids. And yes, if smoking plus alcohol, then what will happen? It will multiply the risk of cancer, specifically oral cancer, esophageal cancer, and laryngeal cancer. And if the person is exposed to asbestos and uranium, that will lead to the increased risk of esophageal laryngeal cancer also. So one thing is good for the smoking, that it prevents a disease called ulcerative colitis. And alcohol, there is something that moderate amount of alcohol, moderate amount of ethanol, it survives some disorders like heart disorders, as it decreases the it increases HDL, decreases the platelet aggregation. But there are some discussion is going on, as either the moderate amount of alcohol or moderate amount of ethanol that is helping the person or preventing the person from disease, or the lifestyle that permits to enjoy the one glass of wine per day. So they are just discussing. So now we will talk about alcohol. Okay, for smoking, the transient pleasure of smoking will end up to the heavy long-term price. You have to pay that price. So if we talk about alcohol, it is having more hazards and claims and consequences than heroin and cocaine. And moderate amount of ethanol increase survival rate than the heavy drinkers or teetotalers who never drink in their life at all. But still, as we know, if we see in medical record, it is written that 20 to 30 gram alcohol per day or 250 ml of wine per day, that will decrease the platelet aggregation, decrease the fibrinogen level in the blood, decrease the coronary heart rate disease, increase the good protein, that is HDL. What is HDL? High density lipoproteins. But keep in mind this discussion that 20 to 30 gram per day or 250 ml of wine that are doing these functions are really from the moderate amount of alcohol or the lifestyle, because lifestyle also changes our body. So let's see what they conclude at the end. Then we will discuss some statistics that in Western world about 50% of the populations they drink alcohol, and out of that 50%, 5 to 10% are chronic alcoholics. And you can say there are 10 millions of people in the Western world, they used to drink alcohol, and out of 10, that 1.8 million death per year due to alcohol, and out of that 1.8 million death, 50% of the death due to drunk drivers, homicides, suicides, and a little amount with liver cirrhosis, out of that 50%. Okay, now we will discuss about some mechanism of action. First of all, when there is an alcohol intake, there will be absorption of ethanol, unaltered ethanol absorption in the stomach and in the small intestine. And that unaltered ethanol absorbed from the stomach and small intestine will distribute equally in the blood, body fluids and the blood itself. And from that blood itself and body fluids, 10% of that excreted unchanged into the sweat, urine and breath. And breath test is done by our law enforcement agencies to check whether the person is drunk or not. Then from blood, there are few enzymes present in the liver. As we know, through portal blood or portal vein, all the blood have to detoxify, first have to go to the liver. So that alcohol that comes into blood have to pass through the liver, and while passing through the liver, there are three enzymes that will convert that ethanol into acetaldehyde. How? There are three enzymes. First of all, there is enzyme called alcohol dehydrogenase enzyme present at the cytosol or the cytoplasm of the hepatocytes, and with the help of cytochrome P450 system, there is production of, due to this conversion of ethanol into acetaldehyde, alcohol dehydrogenase will make metabolic acidosis in the body, increase level of acid, increase level of pH. I have told you acidosis happens only due to three reasons: either there is increased production of acid or proton or hydrogen, or increased reabsorption of acid from the kidneys obviously, or there is an increased excretion of bicarbonate from the kidney. That will end up to the acidosis. So metabolic acidosis done by the alcohol dehydrogenase activity, and there is a multiple accumulation of multiple fat droplets in the hepatocytes, fat droplets in the liver cells, hepatocytes. Then second one is microsomal ethanol oxidizing system. It will be active when there is increased amount of alcohol in the blood. And lastly, the third one is catalase, which uses a substrate called hydrogen peroxide, and it is active when there is almost 5% or less than 5% of alcohol in the blood. So due to the activation of alcohol dehydrogenase, microsomal ethanol oxidizing system and catalase, acetaldehyde will converts into acetate in the mitochondria that will utilize or use into the respiratory chain, that is our electron transport chain, as we have discussed in biochemistry lectures. Now, okay, then that 10% of that unaltered ethanol that has been secreted into the sweat, urine and breath test is done by the law enforcement agent. And we have discussed that drunk drivers must have 80 grams of alcohol per deciliter of blood. And how it happens, you can see over it, if the person is having 3 standard drinks, or if the person had 3 bottles of beer which contains 12 ounces, or the person had 5 ounces of wine. Then we have discussed about if there is a 200 gram of alcohol in the blood, that will end up with drowsiness, dizziness. If there is a 300 gram per deciliter of alcohol is there, then the person lead to this stupor, a state of near to unconsciousness or respiratory. And if there is an increased amount of more than 300 gram per deciliter of alcohol in the blood, that will end up into respiratory arrest. And the chronic alcoholic who is drinking for a long time, that can bear almost 700 gram per deciliter of alcohol in his blood. But that is not an appreciable factor, but it is a factor at all. Now we will discuss about some adverse effect of chronic alcohol and acute alcohol. First of all, acute alcohol. There are 3 target factors, target organs. Samad, please. There are 3 factors, 3 target organs in the acute alcohol. First of all, CNS, stomach and liver. If we discontinue the alcohol, then the consequences or the feature that will go back to the normal position. Suppose about CNS, if we talk about the acute alcohol will lead to depression, and then it will lead to subcortical damage. Subcortical means diencephalon, basal ganglia, limbic system. That will modulate the cortical areas, and that there is an impairment in the cortical neurons, end up in the impairment of the motor system and intellectual ability. And if there is increased level of alcohol in the blood, that will end up into impairment of the cortical neurons and lower medullary center, that will end up into the respiratory arrest. And if we discontinue the alcohol, these features will go back. Okay, we talk about stomach. In stomach, acute alcohol will lead to the acute gastritis and ulceration. And in liver, there is multiple droplets of fat accumulation in the cells of liver, hepatocytes, fatty deposit in the liver called hepatic steatosis. Hepatic steatosis, acute gastritis, ulceration, respiratory, lower medullary center, subcortical, these features can go back to the normal if we discontinue the alcohol. But chronic alcoholic, that is irreversible, and it will shorten our lifespan. Now come to the chronic alcoholism. First of all, most common site of chronic alcohol injury is liver. What happens? Chronic alcoholic, there is alcoholic hepatitis, there is liver cirrhosis, increased portal hypertension, and due to these three factors, there is increased chances of hepatocellular carcinoma. Then second one is bleeding from the GIT, bleeding from the gastritis, bleeding by the gastric ulcer, and bleeding from the esophageal varices. Esophageal varices is also associated with these features also, increased portal hypertension, liver cirrhosis. Then thirdly, we have due to chronic alcohol use, there is a deficiency of vitamin B1. There is a deficiency of there is a deficiency of vitamin B1 or thiamine. Sorry for the inconvenience. Due to alcohol, chronic alcohol use, there is a deficiency of vitamin B1 or thiamine deficiency that will ends up into this syndrome called Vernix Korsakov syndrome. We have discussed in detail about Vernix Korsakov syndrome when we talked about basal ganglia, if you remember. And then it also causes peripheral neuropathies. You can say the neuropathy or the impairment of the neurons are present outside the brain and spinal cord. And then there is a cerebral atrophy, cerebellar degeneration, and optic neuropathy. And then fourthly, we have features associated with cardiovascular system, in which alcoholic cardiomyopathy, more specifically dilated congestive cardiomyopathy. Dilated congestive cardiomyopathy we have discussed. There is first of all left ventricular abnormal dilatation and left ventricular failure that will lead to the right ventricular failure also. You can say both or bilateral or biventricular failure. Alcoholic, that is dilated congestive cardiomyopathy due to alcoholic cardiomyopathies. Then it also causes hypertension that will end up attendant injury to the liver that will lead to the decreased HDL production and also increase the risk of coronary heart diseases. Then fifth number is malnutrition. As we know, the ethanol is a free calorie. 1 gram of alcohol contains 7 calories, but they are useless for the nutritional point of view. So due to that feature of ethanol, there is malnutrition in the patient. Then for sixth number is pregnant female. If the pregnant female, specifically in the first trimester, why first trimester is very important for alcohol or smoking? Because in the first trimester only all our major organs or organogenesis are going on. So pregnant female, if she is alcoholic, then it will lead to the fetal alcohol syndrome. There are a few features like in the baby, obviously fetal alcohol syndrome. If the mother is a drinker or chronic alcoholic, there is microcephaly, decreased mental growth, decreased mental functions, mental growth retardation, and there is facial abnormalities. Plus, it must have facial abnormalities. So, and that fetal alcohol syndrome is irreversible process. Then seventh one is chronic alcoholic can lead to the acute pancreatitis or chronic pancreatitis. And there are some other cancers which are associated with the chronic alcohol, oral cancer, esophageal cancer, and females breast cancer is also possible if the female is having, obviously the female is having chronic alcohol. And the rest of all the alcohol-induced cancers, acetaldehyde is responsible. Acetaldehyde, that is over here, you can see, is responsible for all alcohol syndrome, all alcohol-induced cancer in the body, either it is oral or esophagus or laryngeal or stomach or whatever. So that was about today's class. Do you have any question?
No, sir.
Seriously?
Yes. Thank you, sir.